arthritis is when you lose the cartilage on the end of the bones at the knee joint. And you've got cartilage on the end of the femur, and you've got cartilage on the end of the tibia, the bone on the bottom, the bone on the top. And cartilage doesn't have any nerve endings. It's a protection of the underlying bone. That's why a knee that's healthy doesn't cause any pain when it moves, because the nerve endings in the bone are not exposed. When you lose the cartilage, you expose the nerves and the underlying bone, and when bone starts to rub on bone, those nerves are rubbing against one another, so to speak, and that's where the pain of arthritis comes in. Two main types of arthritis of the knee would be osteoarthritis of the knee, which is the typical wear and tear arthritis, what most people have. Fewer patients have rheumatoid arthritis or other types of inflammatory arthritis. Causes of osteoarthritis, sometimes there's genetic causes with that, sometimes it can run in families. It also is associated with obesity. We've got problems with our society being a little bit too heavy, and that can change the environment, the chemical environment in your body, and it's kind of destructive to cartilage. And then with the added weight, that can add stresses to the cartilage that makes it wear away faster. So obesity is a big reason for the uptick in arthritis globally. I think that the other causes would be potentially trauma. You know, if you've injured your knee in some way, that can cause arthritis. If you've had a previous fracture around the knee, and then obviously rheumatoid arthritis is somewhat of an environmental thing. So risk factors of arthritis would be obesity, as we discussed earlier. You know, trauma, the activities that you engage in, depending if it's really traumatizing to the joint, be the biggest risk factors. Symptoms of knee arthritis would be pain, especially with activity. The longer you stand, the longer you walk. Stiffness, when you first get up out of a chair, it's very stiff for the first couple of steps. Sometimes it gets bad enough that it hurts almost all the time. Even when you're laying in bed at rest, you know, it'll ache. And sometimes you can have swelling in the knee. You start to get stiffness and lose motion. You may not get full extension of the knee. You may have trouble getting further flexion. Diagnosis, you have a pretty good feeling just by talking to the patient, their typical symptoms that they would describe. The exam sometimes leads you down that path. X-rays is one of the biggest ways to diagnose it. Typically we shoot an X-ray of the knee and we can see that there's narrowing of that joint space because the patient is losing their cartilage. And so that kind of tells us it's arthritic. Typically we don't require an MRI of the knee to tell that it's arthritic. X-rays are typically good enough to tell us that it's an arthritic diagnosis. Treatments basically, you know, the first line treatments are all the non-operative things that you can do to help minimize symptoms. You can't really stop the disease process or reverse it, but you can help minimize the symptoms, the pain and the stiffness that's caused by that. Typically, Tylenol, as well as an anti-inflammatory like Motrin, Advil, Aleve, something like that. Sometimes doing a little bit of icing or a little bit of moist heating. Physical therapy and some general range of motion and strengthening exercises is important to help treat the symptoms of that. The next kind of steps would be things like wearing a brace. So we think about doing a cortisone injection into the knee that can help really minimize the pain and inflammation, at least temporarily for a while. The next order of business treatment-wise would be knee replacement. That's kind of end of the road. When your symptoms are bad enough, they really restrict your ability to do what you need to do, what you want to do, and take the fun out of life, so to speak. I mean, it's time to really consider knee replacement. And that's where we remove a small amount of bone and replace that bone with metal and plastic. There's no nerves in metal or plastic. Metal and plastic can rub on one another without pain as long as the bone is covered by the metal and the plastic implant. the nerves in the bone are happy again and they're no longer causing the pain. So this is a model of a knee replacement. It's actually the type that I prefer, which is conformist. It's actually the only knee replacement on the market that has a totally custom option. It uses a CAT scan preoperatively, and the CAT scan shows the three-dimensional data into the computer of the bone. And then they actually can build the implant specifically to match your anatomy. So the exact size and shape and curvature of your anatomy is duplicated, make a metal and plastic knee. Just like fingerprints, genetic makeup, there's only one person with the same type of knee, and that would be you. You know, it's kind of artificial to boil everybody's knee down to like 12 sizes. So some people are a better fit for an off-the-shelf knee, other people aren't. And so how better to match someone's anatomy than to match their anatomy by making the knee replacement specifically for their size and shape and dimensions. So this is a conformist knee replacement. It's kind of very interesting that the medial and the lateral joint lines are treated independently of one another. So most off-the-shelf knee replacements are collinear, meaning the medial and lateral compartments are exactly the same height. This is the only knee system that has different heights of the medial and lateral compartment. So I've been doing this since 2016. My patients have loved it. I've seen improvement overall from when I was doing knee replacements from another vendor that was not conformist. And so I've stuck with it, and I've got lots of happy patients that have had great results with the conformist custom knee replacement.